Good afternoon, everyone, and thank you for joining us. This is Paige Hancock, Marketing Manager at Spok, and I'll be your moderator for today's webinar. Today, we'll be talking about the 7 must-have components for a mobility strategy. Dr. Nat'e Guyton, Chief Nursing Officer at Spok, will walk through critical components for creating a mobility strategy that will enable care team members to make more informed decisions, respond quickly, and improve the quality of care. Before we get started, I would like to go over just a few housekeeping items. Everyone will be muted during today's webinar, but we welcome your participation. Please submit your questions via the questions box, which is in your GoToWebinar toolbar, and then Nat'e will answer as many questions as time allows after the presentation. We'd also love your participation in polls throughout the webinar as well. A recording of this webinar and the presentation slides will be sent to all registrants tomorrow. Please feel free to share these with others at your organization. And lastly, at the end of the webinar, you'll have the opportunity to complete an evaluation. We would love it if you could take a couple of minutes to complete this survey. Your feedback truly helps our efforts to provide you with relevant and informative presentations. And with that, I'd like to turn it over to Nat'e, who will begin our presentation.
Thank you so much, Paige. So this presentation today, we're going to be talking about the 7 strategies or the 7 must-haves. And I literally lived this life with the mobile strategy. And I'm out in the field talking to a lot of my colleagues, whether nursing or physician colleagues or healthcare leaders, and this slide kind of depicts, my mind. Where do we even start when we talk about a mobile strategy, or we're thinking about the devices and we're thinking about the future of healthcare and technology? We think about where do we even start. So today, my goal is to kind of help you process some of those questions that you may have in your mind and kind of help you build a strategy for your own organization, or if you already have a strategy, which is great, hopefully these conversations, these components that we're going to talk about today will help validate maybe some things that you've already done. So again, let's talk about, where do we even start? So we're going to take a live poll, and I'm going to be working with Paige today, and so I'll hand it over to Paige for the live poll.
Excellent, thank you. So everyone should see this poll up on your screen. We want to know, do you have a documented mobility strategy in place? So go ahead and select one, yes or no. I can see a few of us have voted. We'll go ahead and leave it open for a few seconds longer here till we get almost everyone's in. All right. Looks like we're in, so I'll go ahead and close the poll and then share it. So Nat'e, you should be able to see the results of our audience.
Oh my goodness, so look at that, right? So the question, do you have a documented mobile strategy in place? And what is that? 25% said yes, so great for you. And 75% said no. So also, I think, you're in the right place. We're going to talk about how to get that started. And just to validate that, where 75% said no, we're going to talk about some studies actually we've done over the last 5 years, which show the trajectory of that. So in February 2017, Spok surveyed 300 of our customers who are healthcare professionals, and we asked them the same question: do you have a documented mobile strategy in place? And you'll see, in 2012, 34% said no, and 34% said yes, and 66% said no, right? Kind of what we've seen today. And in 2014, you see again, it's kind of moving up, So 44% say yes, we do, because we're starting to understand how important this is, and then 56% said no. So still kind of the line, really trying to figure out what is a mobile strategy. Is it a just selection of the device, or do we have to document some things? And you see in 2017, again, we're starting to see people really think, okay, guess what? We purchased these devices and clinicians are not using them the way we thought. So we're starting to see now more documenting of a mobile strategy and really kind of making it aligned with our organizational priorities. And then in this same survey, right, we asked a couple of more questions. And one, we asked our consumers, does your organization have stated goals to improve the following area? And we have strategic goals and we have strategic objectives and we have some technology challenges throughout our organization. And you'll see here, our hospital customers said, here are our stated goals. Physician to physician communication is a high priority. Nurse to physician communication, nurse to nurse communication, patient throughput, ED and ER and bed turnover, right? And then we ask, is that hospital goal included in your mobile strategy? So, oh my goodness. So hospital says, guess what? We do have these documented goals. And we hear these all the time. But then they said, oh, they're not really aligned with our hospital goals and our mobile strategy, right? They said, guess what? These are goals, but we didn't think of, how will our mobile strategy and our documented mobile strategy help our goals? So you see where the blue line here are the stated goals, right? And then the yellow line are the stated goals that are also a part of your mobile strategy. So when you think about, as we work through these components, and you think about your goals, start to align those goals or match them up with, how will our mobile strategy and selection of device, and then that's just a component of it, if you will, but how will that be impacted, right? And you'll see here, so physician to physician communication, 19%. Nurse to physician communication, nurse to nurse communication. Hospitals are saying, listen, I'm thinking about patient throughput. That's a high priority to us, but we didn't necessarily align that with our mobile strategy, which we should, right? ED and bed turnover. So again, this is great because what we want you to do is kind of identify your hospital goals, your strategic objectives, whether they're clinical or financial, right? Because we want you to get value in your mobile strategy. And we'll talk more about that. Next slide. So what is a mobile strategy? Okay. Because, 7, 10 years ago, we thought, okay, the computer on wheels is a mobile strategy, right? That's mobile. That's our strategy. We took, the paper, we put it into the computer. Here we are with CPOE, meaningful use and all the money that we spent with the EHRs. And we thought, okay, is that our mobile strategy? And so we know over the years it has evolved. And so here is a kind of a high level definition, if you will. A mobile strategy is a high level framework. And the framework that I use to build a couple of things. One, to build and guide your mobile device selection and deployment, to align clinical workflows with selected devices, a device inventory, maintenance, and management, security, and support. So again, as you think about your device strategy, I would say probably 5 or so years ago, I would say 3 to 5 years ago, we thought it was the computer on wheels, right? And then how do we now move to, what is the cell phone choice out there? Is it the Android? Is it the iPhone? Is it the pager? We kind of thought a device selection was a mobile strategy. But these points here, and we're going to go through this in our talk today, but it is a high level framework. And so your mobile strategy that you're going to document should, at the minimum, address these areas. Next slide. So let's take a look at the mobile devices in the market, because a lot of people still say today, okay, what do we consider mobile devices? And so again, my thought process is any device, right? Technological device that is untethered, if you will, right? So there's a plethora of devices out there, and we see this on this slide. We have the iPhone, we have the Wi-Fi phone, we have the SpectraLink phone, we have the Android, we have the Zebra, we have the iWatch, right? We have the iPad, and we also have the pager, right? That is considered a mobile device as well. Next slide. So why is a mobile strategy needed? And again, one, to align mobile objectives with organizational goals. So not just, because the phones is the wave of the future and, people at home like phones, so we should bring them in healthcare. We really should be looking to align our mobile objectives with our organizational goals. And we talked about that earlier in this presentation. And then feed the framework for all mobile related projects, right? So I want to tell you, I lived this life about 7 years ago, and we were going to CPOE, and huge change in EMR vendor in our organization when I worked through the Trinity Health System, and we selected a device. And we kind of did this backwards. We selected a device first, and we realized that, oh, wait a minute, everyone doesn't like this device. It didn't fit. We didn't have the right infrastructure. We didn't have the right Wi-Fi signals and networks. So a strategy is needed to provide the optimal device, right? Not just the device, but the optimal mobile experience for clinicians and better outcomes for your patients. Next slide. So again, this is kind of a recap, right? Because our goal, we're going to talk about the 7 must-have components of a mobile strategy. So one is device workflow. We're going to talk about that. Physician workflow, nurse workflow, EHR integrations, using apps in the clinical space, reporting and analytics, and device selection. So number one, right, this is the first must-have. So in 2017, again, Spok, we did a survey of our customers, and basically we wanted to say to them, what kind of strategy do you have in terms of bring your own device versus hospital issued devices, right? And we found 71% of the respondents, they said they have some form of BYOD, which is bring your own device, is allowed in their hospitals. Now, this is an increase year over year from 2016 to 2017 from 58% to 71%. Now, again, it depends on your hospital. It depends on the roles, the organization. So again, when you're talking about your mobile device strategy, I want you to, one, think about your device workflow. Do you want to have a hospital issued system or bring your own device program? Will the workflow be different depending on the role? And so what that means is, I have some organizations we work with say, well, nurses would have to have a hospital issue device and physicians can bring their own device. So you want to think about, will your device workflow depend on different roles? And also, will they depend on different departments? So I have an organization that we work with that say, doctors can bring their own devices, nurses are issued a phone, but the nurses in the OR can bring their own devices. So again, will the workflow be different depending on role? And you want to think about that. And you also want to think about what we call, some of your other roles outside of physicians and nurses, right? You want to think about respiratory and housekeeping, and you want to think about your case managers, and then your other roles within your department. Will their workflow be different depending on the role? Then when you're thinking about your device workflow, you also want to think about and answer the question, who is responsible for maintenance and upkeep? So when you talk about a bring your own device strategy, if you will, or plan or process, there are less people bringing their own devices. So there may be 250 doctors bringing their own devices to your 2,500 nurses throughout your hospital or your healthcare system. So if you say, listen, well, doctors can bring their own device, so we're just going to emulate that and we're going to have the nurses do their own thing, you really want to think about and talk to IT about who is responsible for maintenance and upkeep. So that's must-have number one. You want to understand and identify your device workflow. Second must-have is physician workflow. how would your doctors like to use their mobile devices? And what needs to be on the device to provide value at the point of care? Now, it's very important that you have your clinical informatics or your nurse informatics team round with doctors and round with doctors as they look at the physician workflows in terms of your mobile strategy in different areas, right? So you want to round with your residents, you want to round with your attendings, you want to round with your hospitalists, right? You want to round with your surgeons and your specialists because we know they provide, their healthcare delivery model is different. Especially, surgeons, I often see that they want a plethora of devices. So they say, listen, love the iPhone. That's my phone of choice, my device of choice. That's when we're going to do the BYOD. But when I go in the OR, I don't like to take my phone. I like to take a pager. So you want to understand the physician workflow and how they utilize or hand off or trade their devices. So you want to have your clinical informaticists round and document that rounding and that workflow with the physicians when they see their patients, and also in the office setting, right? Because how doctors utilize mobile devices in the office setting, again, may be different. What would they like to see? So when we say what needs to be on the device to provide value at the point of care, so you want to ask your doctors, listen, when you're with a patient at the bedside, what would you like to see? What would be considered value to you? When you're dictating, right? And so you kind of you may be in a charting room, or you may be in your car dictating. What would you like to see? What would you like to have on it? I sat and I did rounds with the doctor before, and he said, listen, we're using dictation and we're doing our own. And so I like to have an earpiece and I like to have the app for my dictation. That would be valuable to me. So I can, right after I see my patients, I can dictate on my phone. So again, you want to ask the doctor, and you don't want to forget those specialty areas. Next slide. Number 3 is the nurse workflow, right? So you want to ask your nurses, how will these mobile devices make your life easier? And then the flip side, how will this hinder you? What would you like to see? Can you introduce smart alerting to combat alarm fatigue? And how will these mobile devices enable faster responses to patient requests? Now, and again, when we talk about nursing workflow, you want to have your clinical informaticists or your nurse informatics team to, again, round with the nurses, understand their workflow. Where would they like to use mobile devices? Where is it a hindrance? What would they like to see? Again, I did rounds with critical care nurses, and they said, listen, couple of things we need to see. We love the flow sheet. And so we love the flow sheet because it shows us trends, and it shows us, where we may have issues, right? And so they said, and then we love the EHR that shows us the trend, but sometimes when we look on our mobile device, we can only see a picture of at a glance, right? The patient's vital signs right now, or the alert of the vital sign because the patient had an issue. But we may receive an alert, but I like to be able to go back and check a trend. Like if I receive an alert of a lab on my mobile device, and a patient is here for an issue that would warrant a spike in that lab, I want to be able to go back and see the trend. And so a critical care nurse said, listen, if you don't have that, right, then that's not valuable to me. And so my adoption of the mobile device like a phone or an iPad or a watch may not be as valuable to me. And then, of course, we went into a behavioral health unit. And that nurse said, listen, it's a couple of things we need to have. We need to have the barcode scanner on a device. It need to be able to be kind of drop proof, right? We don't want the screen to break. We need to be able to wipe it off with the sanding cloths and not damage the phone. And we need to have a button in case there is a code and we're with a patient or a safety issue, that we can press a button on the phone and the appropriate security team come to where I am. So I thought that was valuable because sometimes we think the phone itself, the device, and all of the apps and the smartphone technology will make the nurse's life better or easier, if you will. But we find after doing clinical workflow analysis and